Hi, my name is Tobias and I'm a postdoc from the Department of Neuroscience. And today I'm here on behalf of the organising committee for the departmental research meeting, Ben, who won the runner-up oral presentation prize at this year's meeting. So if you'd like to introduce yourself, Ben.
Hi, so my name is Ben Lindsey. I'm an NIHR Academic Clinical Fellow in Infectious Diseases and Virology within the Department of Infection, Immunity and Cardiovascular Disease.
Fantastic. Okay, and what did you present at the meeting this year?
So I presented some results from a project we've been working on for the last 12 months or so, when we've been reconstructing hospital outbreaks of COVID-19 using viral genetic sequence and epidemiological data. So what we've been doing is we've looked at over 2,000 cases of staff and patient infections within the hospital, and we sequenced the whole genome of the viruses that cause their infections. And we also found out when their symptoms started and what their movements were around the hospital. And combining this all together, we were able to look at who was infecting who in the hospital, where these infections were occurring, and when they were occurring.
Brilliant. That's important stuff. Fantastic. And what were the key findings from the work you presented?
Yeah, so we had three kind of key findings. First of which was the people that seemed to be infecting who changed over time. So early on in the pandemic in wave 1, the most common transmission pair was between staff and other staff members in the hospital. And then when we looked in wave 2 and the latter part of 2020, this changed. So the most common transmission pair was between patients and patients, and staff to staff transmission was then the least frequent type of transmission. Yeah. That was our first key finding. Then we found that cases that, or patient cases that had been acquired in hospital transmitted more to other people when you compared that to cases that had occurred in the community and then subsequently been admitted. And thirdly, we found that there were hotspots of infection within the hospital. So 8 to 10 wards over the trust out of a total of about 100 wards accounted for 50% of all transmission throughout the outbreak.
Yeah, fantastic. Okay, so also we can all appreciate the importance of this work in the current COVID pandemic. I mean, but so what are the implications? What are the bigger picture of these, these research findings?
Yeah, so unfortunately, COVID-19 is very much here to stay with us, and it's likely to cause hospital outbreaks for the next few years to come. So the main important things that we can draw from this is better understanding what's happening with hospital outbreaks, and ultimately use that information to try and prevent these outbreaks, and then if they do occur, manage them in a better way.
Yeah, brilliant. Okay, and thinking specifically about the project, I mean, what are the next stages? Is there a paper on the horizon, and what stage are we at?
So hopefully, so just this week finished actually kind of writing up the paper and distributing that. So we hope to be submitting this and getting this published soon.
Yeah, fantastic. Okay, best of luck with that. And thinking of you and your research career, what are the next steps in the near or the long-term future?
So I'm sort of very much at the beginning of my journey as a clinical academic. So I'm in the first few years of my specialty training in infectious diseases and virology. So academically, my next steps are to try and obtain a PhD fellowship, and then leading on from that, hopefully a clinical lectureship, and ultimate goal to become a clinician scientist.
Fantastic. That's great. Okay, well, best of luck with your career, and thanks for taking the time to talk to me today.
Thank you.